Didn't know till I went to the bathroom and thought my guts were coming out, frankly. It kind of scared me and embarrassed me, too. I didn't even want to talk to my husband about it.
When I went to see the doctor that time, he said, well, we can get you back on your feet really fast. There's a new procedure, new products.
I've been liberated. Yes, I have. I can do anything I want to when I want to.
I feel good now. I feel nothing is there anymore. It's really good. It's really nice. I'm surprised.
You are not alone. Half of all women over age 50 experience some degree of pelvic organ prolapse, which can cause pressure-like discomfort, at times pain, and almost always disturbance in normal bladder and rectal function. By age 80, more than 1 out of every 10 women will have undergone surgery for prolapse. The good news is that your choices for relief are better than ever. Symptoms of pelvic organ prolapse may include loss of bladder or bowel control, difficulty voiding, urinary frequency, problems with bowel movements, feelings of pelvic or vaginal heaviness, recurrent bladder infections, excessive vaginal discharge, or discomfort or lack of sensation with intercourse. Pelvic organ prolapse can seriously impact a woman's quality of life.
After I had a hysterectomy, an emergency hysterectomy, it was a couple years later that I noticed that things weren't going just right and things felt like they were falling out. I thought my insides were falling out.
You know, the vaginal wall was weak, the bladder was weak, and it was falling in against the bowel, and I was pretty bad.
I didn't know what I could do about it. I just didn't know. It was embarrassing, and I just didn't know what I could do.
And my doctor told me that my bladder was falling out. But we can fix it.
Pelvic organ prolapse occurs when the pelvic floor muscles weaken and stress the connective tissue supporting the vagina and uterus. As these connective tissues give way, the vagina can protrude beyond the vaginal opening and affect the bladder above and the rectum below. There are 3 major types of pelvic organ prolapse. The most common, cystocele, occurs when the bladder drops out of position into the vaginal opening. Women who have had a hysterectomy are more likely to suffer from a prolapse caused by a cystocele. Rectocele, when the rectum balloons up into the vaginal opening. And uterine prolapse, when the uterus drops and pushes into the vaginal opening.
Nobody wants to hear about your symptoms. I mean, they don't feel very sorry for you because they don't want to listen to, oh, I have to go to the bathroom often and I do have diarrhea quite often. Nobody wants to hear that.
I was uncomfortable walking outside. I was uncomfortable doing my volunteer service at the hospital. Was uncomfortable walking the treadmill, which I try to do every other day.
You know, I was just constantly worried. Because, okay, if I pull on something, then I can feel the drop.
Sex was fairly painful, and my husband had been very, very ill, so it wasn't a big issue right then, but it would have become one as he got better, you know. So it was uncomfortable.
Sexual problems, it was unheard of because there's just no way, and that ceased to exist.
Some older remedies required more invasive surgery with a long recovery time, the insertion of a pessary to help support the pelvic area, and Kegel exercises.
He said, oh, girl, you needed to have surgery. And I said, oh, well, is it that bad? He said, yes, you need to have surgery, and it's going to be 6 months before you're going to be able to do anything. You can't drive, you can't lift, you have to stay in bed because you need vaginal reconstruction, you need all this work done, and it's a major surgery for you.
That's when he suggested the pessary ring and inserted the pessary ring, which did all right for a little while, but it still wasn't too good. And I went back again, and he inserted. He said, well, sometimes some women have 3. I said, oh, good Lord.
I had seen a urologist there, and he suggested that to tack my bladder back in. So we had that procedure done, and it wasn't a year later, I had the same symptoms again. Like my insides are falling out, and I was sitting on a very mushy golf ball. So back I went in, and this is the second surgery. And I thought, well, am I going to do this every 2 years, every 3 years? How often? And am I the only one that has this problem?
Fortunately, times have changed. Gynacare Prolift pelvic floor repair system is a revolutionary surgical technique that offers promising results for women with pelvic organ prolapse, with a less invasive, shorter procedure and a faster recovery than open procedures. Even if you've tried other remedies in the past, Gynacare Prolift could be the answer for you. Gynacare Prolift employs a specially designed supportive soft mesh placed in the pelvis to restore pelvic support. The mesh is inserted through small incisions inside the vagina and then weaved through the pelvis, where body tissue quickly grows into the pores of the mesh to create a greatly enhanced final support. With Gynacare Prolift, the procedure may take less than half the time of traditional surgery. Patients may experience less pain, quicker recovery, and go home the next day. Many patients return to normal activities within 3 to 4 days with complete recovery in a 2 to 3 week period. Despite which type of pelvic organ prolapse you're experiencing, Gynacare Prolift can be used to correct the problem and restore normal support.
When I heard that, I was thrilled. I thought, wow, you know, of all the things, because I had kind of blocked out in my mind 6 long months of recovery. So when he said a couple of weeks, I was really amazed, and I was so happy I went to see him.
Well, the comparison between the 2 operations was night and day. The first one was involved with a lot of pain and a lot of time spent doing absolutely nothing, and the doctor had said this was relatively painless and that I would be able to do normal functions within, matter of a few days. And he didn't lie to me.
My doctor discharged me the next afternoon about 4 o'clock, and I was doing fine.
I thought, I feel, didn't feel like I just had a surgery. And the next day at 12:30, I'm going home. And guess what? When I went home, I was able to go to the bathroom all by myself.
If I'd known about it earlier, I would have done it, much earlier. Just didn't know about it. Thought I had to suffer through it.
Had I known before what I know now, I'd do it sooner. Yes. And I would advise every woman not to wait as long as I did, because it's really a simple procedure.
Pelvic floor repair procedures with Gynacare Prolift are appropriate for most patients, including older women and those who have undergone previous surgery for stress urinary incontinence or pelvic organ prolapse. Treatment with Gynacare Prolift allows for the restoration of sexual function by restoring normal vaginal anatomy. All surgical procedures present some risks. Although rare, complications associated with the procedure include injury to blood vessels of the pelvis, nerve damage, difficulty urinating, bladder and bowel injury. There is also a small risk of the mesh material becoming exposed into the vaginal canal. As with any surgery of its type, this procedure should not be performed on women who are or wish to become pregnant.
I think the thing that surprised me most was the short recovery and how good I felt. And the doctor told me that I would really notice a difference. And to tell you the truth, I really didn't believe him. I thought, well, he doesn't know how I feel, so how is he going to know if I'm going to notice a difference? But sitting, standing, bending, squatting, walking, I notice it all the time. It is an amazing difference.
It means my freedom. It means that I don't have to be embarrassed by frequent trips to the bathroom or saying I can't do something because I'm in fear of pulling out a stitch or something. So it gave me my life back.
It's just not there anymore. And I know that it's here where it's supposed to be. And what a great feeling. What a great feeling. I look like I used to when I was 20 or 30 years old.
When my husband was recovered, I didn't have to worry about the sex problem. I didn't have to worry about painful intercourse. That to me was real high on my agenda when he started getting better.
My sexual life has improved before I had all of this, probably way back to when I was newly married. I don't know what he did.
I'm 83 years old, and I would encourage anyone who has this problem to go through this surgery. You would make it fine. It's wonderful to be free of this problem.
It's simple. It's an overnight stay, and the recovery is much faster now. Within a few days, you'll be back to normal. So why wait? Let's get it fixed.
Talk with your doctor to find out if Gynecare Prolift is right for you. For more information or to find a doctor who performs Gynecare Prolift, visit www.bprolapse.com or call 1-888-GYNECARE to speak with a nurse.